And we see that the generalized stroke survivor is able to improve not only the range of motion and strength, which are of course really important, and those are prerequisite to you being able to do more things, right? It's almost like a foundation for building a building, right? You have to have a foundation, you have to have the sort of base components before you can put together real function.
Hey everyone, my name is Dr. Nick Housley with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
Hello, my name is Philander Cooks. I'm calling from Dallas, Texas. I had a stroke last September. I wasn't able to walk, but now I'm able to walk. My left side is still weak. I don't have full, complete use of my arm. My vision was impacted as well, so I can see, but not clearly as I want to or I used to be able to see.
Okay. Glenda, do you have a little bit of like, is it your whole eye is less clear, or is it like portions of your field of view that are a little bit off?
I have that left field cut.
Okay.
So my peripheral vision, I can't see.
Okay. I just wanted to make sure because there's often different ways that a stroke can impact our visual acuity. And one of the classic ways is that what's called a field cut, where effectively, you know, if we can normally see basically 180 degrees, we have a little bit less on that left side, which is the sort of very, very typical experience. So I think it's good to know that. So about how much is cut, do you know on your left side?
No, I don't know right offhand.
That's okay. That's okay. I'm just asking. I like to ask questions, so that's why I'm asking.
No,
so
okay.
Okay, very good. And so with respect to our time together, what can I do to be helpful for you then? What type of questions do you have for me? I can do my best to answer them.
I guess my biggest concern is, you know, how long does it really take for a person to fully recover from a stroke?
Very poignant question, Philando. I think that is probably the hardest question that I could ever be asked, mainly because there isn't an answer for it, unfortunately. And so I will be the first one to admit that the field of medicine and science is not able to precisely define who is going to achieve full recovery and under what circumstances that will happen. I'd say just generally speaking, if we look at the sort of constellation of stroke survivors, generally speaking, only around 10 to 15% of individuals make what's called a 100% recovery, where you were to do a number of assessments with them, and you would not be able to discriminate a deficit. And so the vast majority of people do have some residual impairments. That being said, many people, the vast majority of people, are able to make significant progress over the course of many months or years. And significant progress is not only statistically significant, but it's very meaningful. And in terms of meaningfulness, like you're able to do things with your arms and your legs that you weren't able to do before. And this is the criteria by which we actually assess the Motus hand capabilities. And I'm trying to start pretty broad for you and then kind of focus in on what the systems have been shown to do. And so with respect to pretty much these types of interventions, which are classically repetitive task practice programs, these are like the gold standard that we have to improve people's function. And our largest trials generally ran around 3 months or 100 days. And those individuals were doing around an hour and a half of rehab for around 5 days a week. So about 100 to 150 hours, depends on how you kind of do the math there and who specifically you were talking to. But during those 3-month periods, people were able to improve the number of tasks that they were able to do before. And those are real things, like I'm able to fold a towel, I'm able to pick up a can, in this case, a coffee cup, a can of soda to their mouth. They're able to pick up a a basket at the grocery, many tasks, pick up pencils, these sorts of things. We were able to quantify the difference in their function before and after. And we see that the generalized stroke survivor is able to improve not only the range of motion and strength, which are of course really important, and those are prerequisite to you being able to do more things, right? It's almost like a foundation for building a building, right? You have to have a foundation, you have to have the sort of base components before you can put together real function.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro rehab.
And so we are able to help improve people's range of motion, reduce their tone, improve their strength. And then on top of those foundational elements, people are able to then improve their functional capacities, fine motor skills, gross motor skills, etc. But it takes a meaningful amount of time. You know, we're not talking about snap your fingers and you get better. It's you have to put the work in and do the numbers or repetitions that are required. And so most people are able to actually experience those types of changes. Now, I will say this, with respect to those clinical trials, they were limited to around 3 months, 3 to 4 months. But we have people now that are 10 plus months post starting the Motus Hand therapy, and they're still making progress. And so it's just one of these factors that the sort of upper limit of what we can actually do is not really known in the literature. It's just because the way that science is sort of designed, it needs to be a bit reductionist, and unfortunately, that means that we don't know exactly what the true capacities are of individuals. And so we're still seeing people improve even though they're 10 months after the use of those systems. And so we think that the real ceiling is probably more than what we've ever observed in the clinical trials. And so that's one of the reasons why we actually sort of designed the systems and the model this way, where you can continue to use it month on month on month until you basically, as long as you're getting benefits from it. And so again, what I'm kind of driving towards here is that it's going to be really hard to say specifically, because every stroke survivor is a little bit different. A lot of their factors going into it are very different, but one of the biggest factors is how much you can do, and in terms of the amount and the intensity of that rehab. And these systems are there to help really amplify what you're able to get at home.
Okay.
Any other questions for me, Felindo?
No, I don't think I really do.
Okay. Well, tell me a little bit about you, and in terms of, so yes, stroke in September 2020. What types of things, you said you have, you're back to walking again, but on that left side, have you made progress on your left side, your left arm?
To be honest with you, I mean, there was some progress. I mean, because at one point in time I couldn't even lift it. Now I can lift it, but it's not like to a full extension, but I can do a little something with it versus nothing. And I think a lot of that was due to the therapy I was in. I was in outpatient therapy and inpatient therapy. So.
Okay. Yeah, and that could be one of these tough things, right? Felindo, when we find ourselves after an injury, we often will get a lot of rehab, right? But then what happens is slowly that rehab goes away, right? Whether it's insurance, whatever it is, a lot of that goes away, and we start to see a tapering off of the amount of rehab we do. We also see a simultaneous or a parallel reduction in our capacities, or the amount of improvement that we're making also goes down. And so what we need to do is we need to reverse that. We need to get you back into doing that high intensity activity to turn that sort of stasis around and to try to make improvements. And so, kind of identifying that you were making improvements, but we need to kind of capitalize on them again in terms of rehab, right? Because really movement is the medicine here. So we need to get you moving and doing that engaged repetitive task practice again to really start to drive improvements again.
How much success have y'all had with y'all device?
Oh, good question. Yeah. So in terms of the success rates, I think I described some of the effects on the sort of functional improvements. And in terms of the numbers of individuals, At this point, the Motus Hand in its current version has helped more than about 1,500 individuals across the country. And with respect to throughout the whole lifespan, the Motus devices have been in existence for almost 20 years. And so they're currently deployed in around 200 or plus hospital systems in the United States, hospitals and clinics. And in the formalized studies, we've helped many hundreds of individuals. But they've all, like I said, they've been deployed in clinics and hospitals. And so we're probably in the thousands to tens of thousands of individuals they've helped. And so it's based on one of the best types of rehab approaches that we have. And so it's helped a lot of stroke survivors and a lot of survivors of neurologic injury, TBI specifically, and individuals with spinal cord injuries. So it's helped a lot of individuals over the years. And again, it's hard for me to say specifically it's going to mean this many degrees of movement for any person or this, that, and the other. But it's been improving function and range of motion and strength in those groups of individuals.
Gotcha.
Yeah. So I'd say, in terms of robotic devices that have been out there, this is, we're going on 20 years of existence, and it's been helping people basically ever since. So it's a relatively encouraging outlook for people who are engaging with it. And Philando, if you do have any questions, don't think this is the last time that we can chat. So if you do have any other questions, do not hesitate to reach out to us. We're here to help support you, and in terms of giving you the information you need to make an informed decision about your health. And so if we can be a part of that, we'd love to be a part of that. Or if we can give you information to help direct you into the best path, we would like to do that as well. But consider us a resource for you. Now, I want to remind you that we do have the support group on Facebook that you can go to, and I think it's the Motus Nova support group. You are more than welcome to join that and chat with individuals who have been using the Motus Hand and Motus Foot for a long time. And so you can post questions to the community there, or just use it as a place to gain information. So I wanted to extend an invitation to you.
All right, thank you.
Of course, yeah. And so what we'll do then is we'll just reach back out and see if you have any questions. But hopefully we'll be able to work together in the future. I really like to do that. And so I will have my team reach out and see if you have any questions in the near future, and we'll just touch base if we need to. Okay.
Okay.
All righty. Well, thanks so much for your time, Philando. I appreciate it.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.